Reproductive issues affect people of all socioeconomic backgrounds. However, treatment is often limited to those that are able to afford it. We argue that infertility insurance should be mandated to increase access to art services and help make distribution of art more equitable. Some art technologies include intrauterine insemination, which fertilizes the egg inside of a woman's uterus. This is a more affordable option than IVF, though it has a lower success rate. IUI requires just one procedure during which the sperm is implanted to the woman. Frozen embryo transfer is the procedure involving undergoing IVF with a frozen embryo from a previous IVF cycle. Frozen embryo transfer is done to reduce the effects of desynchronization. Intracytoplasmic sperm injection, also known as ISI, removes one or more eggs from the woman's body. Then a mature egg is injected with a single healthy sperm. When the egg develops normally, they are transferred back into the woman's body. ISI works best when there are serious sperm issues. ISI allows the doctor to select the healthiest sperm and implant it in the egg.
Assisted reproductive technologies have also been associated with several increased risks for the woman. For example, IVF was associated with significant risks in preeclampsia, gestational hypertension, and placental absorption. Additionally, ovulation induction has been associated with an increased risk for placental abruption, fetal loss, and gestational diabetes.
Next, we'll talk about insurance coverage. Around 10% of American women have received assistance for infertility issues, and the average cost of one cycle of IVF is approximately $12,000 to $17,000, which is very costly and very inaccessible for low-income families. Legal policies in the U.S. include that 17 U.S. states have laws that require private insurers to give coverage for infertility diagnosis and treatment. 15 of those 17 states also require complete treatment coverage. California, Louisiana, and New York specifically exclude infertility treatment coverage from private insurers. There's currently no state Medicaid program which covers artificial insemination or in vitro fertilization, leaving low-income families and minorities with no coverage.
There are a couple questions that ethically arise that are important to answer in order to understand why insurance coverage could be beneficial both in increasing the amount of people that have access to it and decreasing associated risks. The first question is, should art services be available only to those who can afford it? Wealth is a morally irrelevant factor and should not decide who has access to these services. If in fact we view reproduction as fundamentally important, then IVF access should be available to all that can benefit from it, and the use of technology would not be determined based on financial status with insurance coverage. We should also ask if insurance coverage has the ability to decrease associated risks of art services. Many physicians and patients that are low income feel pressure to go against medical guidelines and implant multiple embryos at once because they cannot afford multiple rounds of IVF. It has been proven that multiple implantations come with increased risk for both the baby and the mother. Insurance coverage would help make safer decisions rather than more affordable ones. Furthermore, there's a question of, is infertility a medical condition? Many other recognized medical conditions do not kill, just like infertility doesn't, but are still covered under insurances. Infertility should be treated the same way. Fertility treatments are medical treatments that can relieve suffering. Finally, decreased access to reproductive technology because of financial status also prevents certain individuals from proper preventative health care because of infertility. Diagnostic testing can reveal many chronic diseases such as polycystic ovarian syndrome, different types of cancers, and even pelvic inflammatory disease.
Insurance mandates reveal major socioeconomic disparities. In states that have enacted insurance mandates, such as Massachusetts, we see that the majority of people accessing ART are Caucasian, and over 60% of patients have an annual income of $100,000. ART services still remain unavailable to the poor and uninsured, as this is an institutional problem that may not be fixed through mandated insurance laws. Furthermore, questions arise, one being whether ART is preferable to adoption. There are a large number of children in the world without homes, and adoption brings about social good and gives loving homes to those kids. However, people value genetic and cultural relatedness, but that does not make ART a preferable means to become a parent. Some argue that society is also not obligated to mandate insurance to ensure that people are able to have genetically related children. However, everyone has the right to a family, and who is to control by what means that takes place?